Breast cancer is a cancer which generally starts from the breast of a woman, occasionally in a men, and it generally starts in the form of a small lump or a swelling. So, breast cancer, like any other cancer, develops because of uncontrolled multiplication and proliferation of certain abnormal cells in the breast of a patient. Normally, the proliferation or mitosis or multiplication of cells in the human body is controlled. But when the growth becomes uncontrolled, there is a unstopped, non-stop growth of certain cells, then it leads to cancer of the breast. Breast cancer is a worldwide problem. But the difference between breast cancer incidence and prevalence in US versus India is that India has more younger women with breast cancer. So even younger women, women who are younger than 40 years, can also get breast cancer. And the same symptoms which I had just elaborated, which means feeling of any lump, any ulcer, increase in the size of the breast, change in the shape of the breast, or the nipple getting pulled inside, or change in the texture of the skin over the breast, or any swelling in the underarm or in the neck region. These are the symptoms which one has to watch for. Generally, mammogram is not recommended below the age of 40 years because in younger women, breast is dense and is not well seen on mammogram. In case they feel any abnormality, then they have to generally go and do ultrasound of the breast, or if required, sometimes they have to do MRI of the breast to check for any abnormality. So the common symptoms of breast cancer for which one should watch out especially includes any breast lump, any swelling in the breast, any change in the size of the breast, change in texture of the breast. Sometimes some women complain that their nipple was getting inwards, it was getting pulled inwards. Nipple is normally projecting outside of the breast, but if it gets sucked in, it gets inverted, then that is also a sign of the breast cancer. Some women would complain that their skin of the breast became like an orange peel, had a very shrunken appearance. Occasionally, women can also complain that they had some swelling in their armpit, underarms, or around the neck, in the collar area because of the breast cancer. In a very, very advanced stage 4 breast cancer, patients can come up with complaints of back pain, loss of weight, loss of appetite. The breast cancer has two kinds of risk factors, modifiable and non modifiable. So let's first look at the non-modifiable risk factors for which we cannot do any modification. For example, first risk factor is being women. Being women itself is a risk factor for breast cancer, which means practically every woman is at risk of breast cancer and needs to be empowered with knowledge to detect it early. The second risk factor, non-modifiable risk factor, is advancing age. As the age increases, for example, from 40 I become 50, 52 I become 60, then as the age increases, the risk of breast cancer increases. The third non-modifiable risk factor is a family history. Suppose somebody has a family history of breast cancer, which means the cancer is running in the genes. Then this is also a non-modifiable risk factors. These are the factors for which we cannot do anything. But then there are modifiable risk factors, which means these are the factors which we can control to decrease the risk of breast cancer. The first modifiable risk factor is nulliparity, which means not having children. Not having breastfed the children is a risk factor. So, and having late childbirth, having no children or having late childbirth, both are equally high risk factors for breast cancer. So we generally teach women that they have to respect their biological clocks, which means get married in time, have children, and as well as breastfeed them. Second modifiable risk factor is the use of oral contraceptives. These days, the newer generation of oral contraceptives are much safer and do not increase the risk of breast cancer alarmingly, but still they increase the risk of breast cancer. So, oral contraceptives should be minimized in use. The third factor is obesity. So, weight management is important to keep the risk of breast cancer away. It is also a risk factor for many other cancers. Even a consumption of alcohol and smoking have been shown to have some impact on the incidence of breast cancer. So, by adopting a healthy lifestyle, we can decrease the risk of breast cancer. Early detection is the key for curing breast cancer. If I talk of cancers in women, there are two common cancers which occur in Indian women. One is cervical cancer and the other is breast cancer. For cervical cancer, we now have an effective vaccine available for its prevention, while for breast cancer, we do not have any vaccine. So the only chance of high cure rates is early detection. So early detection is the key. If the cancer gets diagnosed early, then the patient requires lesser treatment, which means there is lesser cost, there are less side effects, and the cure rates are higher. So, early detection of breast cancer is a message which one must spread to everyone. So, these are the three pads of the fingers, these. So, we are supposed to examine our breast using the pads of the finger. They have to feel their breast in a clockwise manner, in a systematic manner, so that the entire breast is felt. Now, this examination can be done either while women are taking their shower or it can be done in lying down position. What is important is that we must not poke our fingers inside the breast or try to hold the breast like this between the two fingers. The breast has to be felt with the pulp of the pads of the finger like this. It is important that if you feel any lump or any discharge or any change in the texture, then do not panic but see your doctor. I also wanted to emphasize that while doing breast self examination, timing is very important. For women who are getting their regular monthly menstrual cycles, they are advised to do their breast self examination a week after the cycle is over. For women who have become postmenopausal, where the menstrual cycles have ceased, they can fix up a day, any day of the month. For example, first week, first Sunday of the month, first Saturday of the month, or first of every month, something like that. For them, there is no specific instruction as to when it should be done. There are three dominant methods which are available for early detection and screening of breast cancer. The most easiest one is self examination. So, women after the age of 25 years, once in a month, must examine their own breast by looking and feeling their breast. We generally tell them that right hand should be used for feeling, palpating the left breast, and the left hand should be used for feeling the right breast. There are several videos and materials available on teaching women how to do this breast self examination. Through this breast self examination, if there is any abnormality, any lump, any swelling, they can pick it up. Another two methods which are available for breast cancer screening are called as clinical breast examination, which means once in a year, as a part of their routine health checkup, general women must get their breast examined by a clinician, by a doctor, so that in case there is an abnormality in the breast, it can be picked up. The third important pillar for breast cancer screening is called as mammogram. Mammogram is a kind of X-ray of the breast. It is recommended that women after the age of 40 years must do their mammogram once in a year for early detection of breast cancer. I also want to add, if some women is examining themselves and they feel a lump or abnormality in the breast, please do not panic. Majority breast lumps are non-cancerous, but then they must see a doctor to get it checked. Very rarely, women during their pregnancy or when they're lactating, they can develop breast cancer. So sometimes Especially in the lactating women, it is not easy to feel the lumps. It is not easy to feel the swelling in the breast because the breasts are anyway enlarged and swollen in the lactating phase and in the phase of pregnancy. So, in case a woman feels any lump, it is best to go and see a doctor and at least do a ultrasound of the breast. It is very important to remain alert, and when you're seeing your doctor, sometimes you can even ask your doctor a pointed question. Doctor, do I need to check this for cancer or not? But generally, ultrasound of the breast gives you a good answer to this question. Men actually do not have breast. They have very tiny breast tissue in their chest. But rarely, breast cancer can occur in men also. So for them also the process is same, that they need to examine their chest and the area around the nipple for any abnormality or any swelling or any bulge or any discharge. And if they feel anything abnormal, then they have to see a doctor and do an ultrasound of the breast. Mammogram and MRI of the breast are not the investigations which are done for men with breast cancer. Generally, it is recommended that mammogram has to start once in a year and clinical breast exam once in a year after the age of 40 years. So is the recommendation for clinical breast examination by a physician. But one has to remember that even in age group of 25 to 40 years, breast cancer can occur. So for the age group of 25 to 40 years, only breast self-examination is advised, and SOS as and when required, they can go to a doctor. But actual breast cancer screening has to start after the age of 40 years. I also want to add in this that suppose somebody has a family history of breast cancer. To give you an example, suppose a lady says that, my mother had breast cancer, then she has to start her screening 10 years before the age in which her mother got breast cancer. So, for example, if she says that my mother is fine today, but she had breast cancer at the age of 40, then 10 years before that, which means at the age of 30 years, this lady has to start her breast cancer screening. Mammogram is essentially an X-ray of the breast. It has a sensitivity of more than 70%, which means in 70 to 75% patients, if there is a lump, then the mammogram can pick it up. Sometimes in a younger women or even in an older women with dense breast, we do mammogram as well as ultrasound of the breast to be sure of diagnosis or ruling out cancer.